Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about testing and trialing or doing a mock-up, any of those sorts of things. So this question or this spiel comes about from a question that was emailed to me about a client whose little dog had torn cruciate, but there was also suspicion of a meniscal tear. And they had pretty much convinced the owner that surgery was in this dog's best interest, but a family member had convinced them to try conservative. And so what would I do? What do I think about that? So realistically, in that scenario, I think surgery is best. So that's not what this is about. But what it is about is, so now you have an owner that has decided that this is the trajectory they want to go. And you can either fight with them to make them go this trajectory that you think is better, or you can set up a test. Set up a trial of therapies or trial of whatever it is you're thinking you want to use. And this is viable and this is still worthwhile. So let's say in this scenario of this little dog with the meniscal tear, fine. So then you can say to that owner, okay, let's try conservative management and we'll give it 3 to 4 weeks tops. And in that time, I want to see that your dog is using the leg better, is weight bearing better, that the thigh has grown, that we know that conservative management is something that is working and can continue to work for this animal. Now, this could be also if you're thinking to brace or not to brace, or how will this dog do with a brace, let's say for a carpus, a stifle, or whatever, and they don't want to, oh, great, now I've got, why does that happen? Okay, but they don't want to necessarily put the money towards a proper brace to begin with. So, fine. Create something that is a mock-up, that's a trial, or a less expensive brace to see, how does the dog respond to this? Or let's say it's a carpus, just even putting vet wrap or maybe padding and vet wrap, see how the dog does with that. So you can do a test or a trial there, or whatever, one form of therapy or another, okay? But what I would say is choose your outcome measures that you're going to use so that you can be objective about whether this worked or not. So if that's, I would say video this animal before, so as your day one, so you can check on that afterwards, whatever timeline you think is appropriate. You could do weight bearing, so whether it's stance analyzer, whether it's 2 bathroom scales, you can do limb circumference, see if things are growing, looking for pain responses, all of those sorts of things. So this can be your trial to see if this is going to work. And then if it does, you can carry on. And if it doesn't, you have some grounds then to say, okay, we've tried it. I think now we really need to choose this option over here instead. So I think it's worthwhile to look at things and give people a little bit of choices and be open to working with them instead of saying it has to be this way because it's their dog, it's their choice. So give them some options to help empower them, but also give you the objective information you need to show them that whether the option they chose is working or not working. Anyways, that's it. Until next time, cheers.